Welcome to the Chiropractic and Legal Injury Podcast, recorded live at our events. We're here bringing you the expertise, insights, and tools you need to navigate the world of personal injury care and to uncover what you didn't know about car accidents. It's no accident you're listening today, so let's get started.
All right, good morning and welcome to the Chiropractic Legal Injury Conference. And we are joined today by Dr. James Keller, who we've had the pleasure of working with for years, hundreds of cases together. Thank you so much for being a part of this podcast and for joining us today. What were you looking forward to the most about being here?
Well, first of all, Larry, thanks for inviting me. Really appreciate it. I think coming to this conference, having all these specialties come together, it's a really unique opportunity, both for myself to kind of hear how other people present similar cases, but also for the individuals that are coming to actually learn from this conference to see kind of how these different specialties work together.
It's amazing. And your office really specializes in collaborative efforts with chiropractors, surgeons, et cetera. So can you tell us a little bit about the process?
Sure. Yeah. Sometimes patients present at different stages in their treatment. And so oftentimes what happens is an individual will be in an accident. They'll be seen by a chiropractor. They'll be treating with the chiropractor for a while. Maybe some imaging studies are done. And at some point they realize that they need some assistance in evaluating these cases. And so hopefully at that point, those patients end up in our office. And so we get to evaluate them, again, get a really good history, decide whether or not additional imaging studies are needed. We evaluate those imaging studies and kind of take it from there. And so based on what we find, we can decide whether or not their treatment is still amenable to non-surgical, more procedural-based care, or they need something additional. In addition to that, one thing that's oftentimes missed early on is there's a lot of emotional and head-related things that come up, and so that's another place where we play an integral role in making sure that people get better.
Absolutely. Now, pain management is kind of a vague term, so tell us a little bit about the actual pain management modalities or treatments that you do in your clinic.
I think this is one of the things that oftentimes scares patients away from coming to visit us, is they hear pain management and they think to themselves immediately that it's going to be medications they don't want to take,
right,
or injections they're afraid of. And so, one of the things that's really important about an injury is understanding kind of the course of that injury and its healing time. When are they expected to see improvement? When are they not? And so we can help guide patients and say, hey, you know what, it's okay to be conservative and be gradual with your treatment, but also to recognize when things aren't moving in the right direction. And so then medications can become useful because it helps them participate in these non-interventional type of modalities, whether it's chiropractic care, physical therapy. And then if these things don't work, the same idea, the sooner you get people back to a 100% recovery, the more likely that they'll stay there. If you kind of drag it on over time, then their recovery is never going to be 100%. And so we can offer injections that speed that recovery, whether they're, again, just for pain control or they actually help with the healing process.
There's a phenomenon in the chiropractic community where, and it's phasing out, but chiropractors were hesitant to refer to pain management earlier in a case, and they would wait 3-4 months down the road when the patient was still symptomatic and then refer to pain management. And I never understood that, because you would think right after an accident, that's when people are in the most amount of pain, and that's when pain management would be so integral. So I've always liked when pain management got involved earlier in the case. And for me, what I love about working with you specifically and your practice is you know how to work well with chiropractors, especially at the early stages of the case. You guys order MRIs, you do the diagnostic studies, and you communicate. You speak with the physicians, the chiropractor specifically. You speak with the client, so everybody's on the same page. And from personal experience, I can't tell you how invaluable those services are, particularly with the identification of the injuries that everybody is treating for, disc herniations, et cetera. And the pain management procedures that you provide, the whole purpose of them is to help the patient feel better while they're getting rehabilitation. So if you were to speak to chiropractors who are thinking about referring out to pain management and the timing of referring to pain management, what advice would you give them?
Yeah, so I think, one of the things that's important to understand first off is I come from a university-based background. I know that Dr. G has also worked in an entity where there's multi-specialty group.
Sure.
Being exposed to that really helps people understand the value that each player brings to the table. And so I think most of us in the medical legal space, we kind of practice on an island. And so oftentimes we feel like when we send a patient out, what ends up happening is that individual never comes back.
Right.
So that's number one fear. And first off, like that's not the case. Secondly, the reason that it's important that there's kind of an integration of specialties early on is because what happens is that when a chiropractor finds that they're not making progress with a patient, rather than say, well, let's drag it on a couple more weeks, we'll keep our fingers crossed, maybe time's going to be the thing. If we throw on a little bit of sprinkling of whether it's medications or injections, all of a sudden then they get that response. And so people, again, the sooner you recover, the more likely you're going to get that 100%. And again, we're not in the business of stealing patients from other people. It's about sharing and helping people get better. And so,
yeah, and we've never had that experience with your office. I have to ask you about Dr. Giacopo, who was on the podcast a little earlier. So he started off as a chiropractor and transitioned to a nurse practitioner, and has a unique relationship with the chiropractic community. What's it like working with a guy like him?
So what I love about him is that, again, he understands probably more than anyone this integration of non-invasive passive modalities and the things that we offer in our practice. And so, he's able to kind of really go where patients are and help them alleviate their fears, understand like what is this treatment valuable for, and he's just been a really great individual to work with.
Yeah,
so.
and what an amazing bridge to have with the chiropractic community. He was one of them, speaks the language, and he understands the importance of collaborating and treating concurrently with the chiropractic physician. So you guys do an amazing job. Is there anything else you would like to tell us about your clinic or your practice that you feel chiropractors and future clients would want to hear?
Well, that's a pretty big open question. Lots of things I could say. I think that the biggest thing that's important is one of the reasons I chose physical medicine and rehabilitation is that it focuses on a return to function. And so when people come to see me, my goal is not to push what I have, not to push my agenda on them. It's really, where are people at? What are they looking to achieve? What can't they do? And I get the joy of helping them kind of regain that function back. And so I think, any practice that kind of presents themselves as an aid to an individual's recovery, that should be looked at with, a keen eye, and patients should be referred there. So I wouldn't want to set myself apart and say I'm different, or our practice is different than other specialties or other clinics, but I think like that piece is really important. We listen to people, we really help them kind of overcome their fears and gain their function back.
Absolutely, and you guys do an amazing job. Documentation is excellent, and as I was telling Dr. Giacopo, I think we've had over 1,000 cases together over the years. And I remember when I was a baby lawyer, just starting out with my practice, and the former owner of Comprehensive Pain Management, your predecessor, Dr. Shergin, I distinctly remember going to a party he invited me to, and nobody knew who I was, and I was, that young aspiring attorney with business cards, huge stack, introducing myself to everyone. And I always loved the way your office has treated me, whether I was a, baby lawyer or now coming up on 19 years of practice in law. You guys have always been consistent, charming, intelligent, caring. You go above and beyond the call of duty. And it's just such an honor and a privilege to work with people of your caliber. So thank you for educating me along the way, helping my patients, my clients, getting them in early, taking good care of them. We really appreciate everything that you do. Thank you.
Yeah, well, the feeling is mutual, Larry.
Thank you.
Really have learned a lot from you as an attorney, so thanks for that.
Oh, it's my pleasure. Thank you again for participating in this, and we're very excited to see how the panel goes today.
Yeah, so am I.
All right, thank you.
You're welcome. Thank you.
Good job. Thank you.
From all of us at the Lazzara Law Firm and the Chiropractic and Legal Injury Conference, thank you for listening. We hope you never need us, but if you or someone you love does, know they'll have a team dedicated to helping them rebuild, recover, and reconnect with what matters most, their loved ones and the life they deserve. This is the Chiropractic and Legal Injury Podcast, where knowledge is power and collaboration transforms care. If today's episode opened your eyes, share this episode with your network and help spread the word about the realities of personal injury care. Follow us on social media to keep learning and connecting with this incredible community.